Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? The elimination of enhanced premium tax credits has led many Americans to drop their marketplace plans in favor of cheaper partial coverage. Alternative plans may cut recipients' premiums in half or even more, but typically only cover fixed amounts or isolated types of healthcare like urgent or routine care, forcing patients to purchase multiple plans to ensure access to their care. These plans fail to meet federal standards for the comprehensive coverage, leaving many rural populations exposed to unexpected cost. They also pose a significant barrier to potential recipients by enforcing regulatory guardrails or only offering short-term policies excluding pre-existing conditions. Over the last year and a half, access to affordable health care has dramatically declined, especially in rural communities that are often sicker, farther from hospitals, and dependent on organizations or systems that need adequate reimbursement to stay open. This decline indicates the vital importance of programs like Medicaid and Medicare that serve our most vulnerable of populations. But the perpetual rollback of federal funding for these programs guarantees a negative outlook for the years ahead. On to the damage report. Cyber attacks on hospitals have increased dramatically over the last few years. Most recently, NYC Health of Hospitals Corporation, the largest public health system in the nation, experienced a data breach that affected 1.8 million individuals whose patient data was accessed. The hackers are reported to have had access to the corporation's network for 11 weeks before it was discovered and the system was secured. The investigation is ongoing. John Rigi, National Advisor for Cybersecurity and Risk at the American Hospital Association and past guest of Rural Health Today, identified the 3 main anticipated cyber risk in healthcare for 2026: geopolitical tensions, cyber attacks against third parties, and autonomous AI-generated and facilitated cyber attacks. However, John encourages hospitals by pointing out that we are prepared with a robust understanding of cyber attacks against the healthcare industry, and leaders can depend on the American Hospital Association to unite hospitals across this nation in the ongoing effort to secure our systems.
And now for today's success story. This is Kirsten Newlon, Rural Health Today podcast producer, bringing you this week's rural health success story. Hillsdale Hospital President and CEO J.J. Hodshire, your podcast host, was recognized by Becker's Hospital Review as a 2026 Rural Hospital President and CEO to Know. Leaders were chosen based on their success driving financial and service line growth in rural healthcare systems. JJ was selected for developing initiatives that further the hospital's mission to be a guardian of healthcare services in our community. He was recognized for his work on this podcast, expanding access to rural healthcare in our community and advocating for patients at a local, state, and federal level. Congratulations to JJ for this achievement.
Thank you to our sources for this episode: KFF Health News, the HIPAA Journal, the American Hospital Association, and Becker's Hospital Review.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.